Good evening, everyone, and thank you for joining tonight's session sponsored by Westminster's Peace and Justice Work Group. I'm Lynn Keelhorn, and I'm happy to introduce tonight's speakers. So this evening, we will be introduced to ALICE, Asset Limited Income Constrained Employed. These are families who struggle paycheck to paycheck and workers who are the backbone of the US economy, and during the COVID-19 pandemic became known as essential workers. ALICE families live in every county in the country, urban, suburban, and rural, and they include people of all genders, ages, and races, ethnicities across all family types. Yet some groups are disproportionately ALICE, notably those who have faced persistent discrimination and systemic barriers. So tonight, we'll learn about new ways of measuring poverty and financial hardship, the numbers for Delaware, and the ways you can use the research for action. ALICE is an initiative of the United Way of Northern New Jersey, and Delaware native and resident Stephanie Hoops is the national director, United for ALICE at United Way of Northern New Jersey. She's overseen the expansion of ALICE from a pilot study of the low-income community in Morris County, New Jersey, to the national effort with ALICE data for all 3,000 US counties. Dr. Hoops has taught at Rutgers University, Newark, and Columbia University, and has a doctorate degree from the London School of Economics. Her research has garnered the attention of local, state, and national media and legislators. Most recently, she testified before the US House Rules Committee on Food Insecurity. She is joined this evening by several colleagues, in part because she is currently in a national airport and may not be able to chime in at all times. So her colleagues this evening are Catherine Connolly, Director of Research Engagement at United for ALICE, Delaware native Max Holdsworth, United for ALICE Research Associate, and Molly Devois Rennie, Director of Strategic Partnerships. So welcome all of you. We have a whole team here to present. We're excited to have you, and please take it away.
Thank you, Lynn. And we're so happy to be here and have an opportunity to share our work with you tonight. So we put together some slides to introduce our work. And please feel free as we're going through to stop and ask questions. We can keep this really informal. And then we'd love to open up the discussion following the slides to get your comments and questions and see how we can support any work that you're doing in your community. So Max, are you sharing your screen?
I'm bringing it up now.
Okay.
Can you see my screen?
I can.
Great. I think that I've selected the right setting. Okay.
Okay. You can go to the next slide, Max.
It's not advancing. Here we go.
There you go. Okay. So our agenda for our presentation is first, we just really want to introduce you to ALICE. I know for many of you, this is probably a new terminology. And then we want to talk a little bit about how ALICE fared during the pandemic. Then we're going to share our brand new ALICE in Focus research series with you, and also some tools and resources that are available on our website. And then, as I mentioned, we'd love to open it up and have a conversation with you about the work and any questions that you might have. So Lynn gave a really nice introduction to our work, but just to reiterate some of it, the project started in 2007 through the work of our national director, Stephanie Hoops. And it really came about because of the idea that the traditional economic measures were really not capturing this group of people who lived really just above the federal poverty level, but were not making enough money to survive. So that it didn't capture the true extent of all the households that were experiencing financial hardship across the US. And from that was born the ALICE, United for ALICE project. So currently we have data for all 3,000 counties, more than 3,000 counties in the US. We partner with 24 states throughout the country. And we basically are partnering with our state and local United Way colleagues and also their stakeholders and community organizations and partners. And what we're trying to do is bring this data to inform change strategies and to try to promote financial stabilities for households that are struggling to get by. Next slide, Max.
I'm trying.
Is it stuck? Yeah.
There we go.
There you go. Okay. So just before we get into the meat of our work, we thought we would stop and just share some of the terminology with you so you're a little bit more familiar with what we're talking about. So ALICE is an acronym that was developed by United Way that stands for Asset Limited, Income Constrained, Employed. So these are people that are working typically in low-wage jobs that are struggling paycheck to paycheck. So they're just scrimping by, meeting or not meeting their basic needs. And what we've done is develop a household survival budget for each county in the state, in the US, and it includes just the bare minimum. So costs for housing, childcare, food, transportation, healthcare, and a basic smartphone plan. And so households that are not able to meet this budget fall below what we call the ALICE threshold. And so when we talk about households below the ALICE threshold, and you'll hear us saying that a bit during the presentation tonight, we're talking about both households that live below the federal poverty level and households that live in between the federal poverty level and the ALICE threshold, which is determined by this budget that we have, a minimum household survival budget that we've created. So now Max is going to take you through some of the highlights from our most recent Delaware United for ALICE report.
Sure. Hi, everyone. So last year, we started our partnership with the United Way of Delaware, bringing the ALICE research to Delaware and looking at the households here in Delaware. And so when we establish the household survival budget, like Catherine talked about, we can then figure out how many houses don't make that amount. So breaking down the 376,000 households in Delaware in 2019, this shows us that 11% of households were in poverty below the federal poverty line. And then 27% we found are still not making that ALICE threshold. So we would say that 38% of those households are below the ALICE threshold in Delaware. And this is 2019 data. So this really set not a great picture for what was going to happen in Delaware and across the country when the pandemic and lockdowns hit. And we will talk about that a bit further later. So the next slide shows this household survival budget, and it might be small, but I'm going to read out these numbers. So when we have household survival budget, the bar on the right, the tallest bar, shows the household survival budget for a family of 4. So this includes the cost of childcare for 2 children. And so that's that colorful bar at the right. And the dotted line in gray shows what the federal poverty line is for that amount. And so monthly, the federal poverty line would say that's $2,100 for a family of 4. But the ALICE household survival budget shows that $6,800 in Delaware is necessary for financial security. So as you can see, the same thing with the survival budget for 1 adult. The federal poverty line is much lower than they need to survive. And the bar on the left shows the most common ALICE job in Delaware, cashiers, which are making $10.67 an hour on average. And that goes to a monthly income of $1,700, which is above the federal poverty line, but below the household survival budget of even just 1 adult. So maybe I should ask, are there any questions here with our the components of our budget? We use, as Catherine said, all public sources for data, mostly government sources for price data. So that is what you're seeing in this chart right here. Okay, so this next slide shows the breakdown of those households in Delaware, those 376,000 households in Delaware. And it shows this broken down by different demographic groups like household composition, race and ethnicity, and age. And so these dots show, the blue show the households below the ALICE threshold, and the yellow show the households above. And so we can see with this chart that in Delaware, by far the largest racial group is white. And the next slide I'm going to show you, but also you can see it in this column, this column here, is that the percent below the ALICE threshold is actually the lowest in the white racial group. So that would mean that the white households are less likely to be below the ALICE threshold. And that's what this bullet says. Certain groups are disproportionately represented. So here in this figure shows 5 pie charts. And so the pie chart, actually, I think there was a question. Maybe we should address. Someone raised their hand.
Yes, I do. It's Charlie McDowell. My question is, I'm wondering if somebody who's not very sympathetic to your approach, how would they challenge your calculation of the survival budget? And maybe a related question is, I have oftentimes seen comment to the effect that that studies of poverty don't accurately reflect government transfers, benefits and stuff like that. So I don't know if those two questions are related or not, but those are my questions.
Okay. Yeah, those are good questions. So the first one, the second one, actually, I don't know if you've ever heard of the supplemental poverty measure, but that's actually another kind of product, I guess, that goes along with the federal poverty line. That is, it takes in those federal programs into account. Now, when we come to ALICE households, they're actually earning often too much to be eligible for those programs. So when we come to our household survival budget, which is why we break these down into their different categories, because sometimes people could say, oh, 82,000, it's not a little, it's not a small amount. But then when you start breaking it down, we find that people can think, well, getting housing for a family of 4 for $1,100 a month would be a difficult thing to do, or food for $880 would be a difficult thing to do. But our methodology goes into how these categories we've selected, we've opted for the lowest cost of the options. For example, the food is actually the Thrifty Food Plan, which happens to be the lowest of these plans that the USDA comes out with, which is also a basis for SNAP benefits. So I don't know if that answered your question, or maybe Stephanie, you want to say something?
Yeah, Max, I think you covered it. We take great accused of inflating the numbers. And usually when we present this budget, most of the comments are that the amounts are too low. It's very hard to find a 2-bedroom apartment for, a family of 4 at $1,100 a month. And even less for, a single 1-room or an efficiency apartment. So the challenge is when you add it all up, it does sound like a lot. So the federal poverty level does not break itself down. You don't know how you're supposed to spend that money. And most people who work in the field recognize it is woefully inadequate. And as a result, we see multiples of the federal poverty level being used for most programs at this point.
So that does raise a good question. How is the federal poverty level determined?
Stephanie? I think that we talk about this in our reports. It's based on a measurement of the cost of food, but this was done back in the 50s. So with the assumption that food was 10% of a family's budget. So
no, actually it was 1/3 of the budget. So it's
third.
changed so much since then. Yeah, but
Yeah.
You're exactly right, Max. It was 50 years ago when Lyndon Johnson needed something for his war on poverty. And so it's actually that number, what it costs for a family of 4, multiplied it by 3 and tip that number up by inflation. And that's pretty much what the federal poverty level is today. It's the same number across the country. So it doesn't take into account the different cost of living from and in addition to the changes in our lifestyle and what you need to live and work in the modern economy.
Yeah, you broke up a tiny bit there, Stephanie, but that is what I was just going to say too, is that the federal poverty level doesn't take into consideration variations in cost of living across the US, and the household survival budget, because its county level budget does take into consideration the differences in cost of living. You can really see that if you look at on our website, we have maps of all of our states, and you can really see how cost of living varies from one end of the state to another. And I'm sure we would see that in Delaware as well.
Yeah.
Do we have another question from David?
And just hopefully a quick question. Well, we've got these numbers in front of us. Do you know what the median family income in Delaware is?
No, I'm sorry. I don't have that on me. Okay, I think we can move on. So this is the figure that delves into the groups that are disproportionately affected by financial insecurity. So you see that on the pie chart on the right would be combining all households. And so 38% of those households are below the ALICE threshold. But these other 4 groups, Black, Hispanic, single female headed with children, and under 25-year-old headed households are highly disproportionate under the ALICE threshold, which is something that we like to highlight, that even though the largest group may be white households, there is systemic issues that go into why these numbers are so high. Okay, so this next map, and I know you said your group is all over Delaware, which is great because this is a figure that shows all of Delaware. And so on the left, we break down, as we were saying with this household survival budget, we break down based on county. We make the household survival budget at the county level. And in so doing, we can look at number of households that live below the ALICE threshold in different geographies, lower than counties. And so the figure here on the right shows those percentage below the ALICE threshold in county subdivisions across Delaware. And you can see roughly that the darker blue is greater percentage below the ALICE threshold, more financial insecurity, and the white or lighter blue is a lower percent below the ALICE threshold. And one thing I find shocking, and this is something that is in the report, and we can also click through on the website, is that the max, the highest number of percent below the ALICE threshold is 61%, and the lowest is 17%. And if you see on this map, that actually is in these two county subdivisions here, around the city of Wilmington, and then kind of Hockessin area here. So that I think is very notable. Probably not a surprise. It wasn't a surprise to me being from Delaware, but something that comes up in this map. And large shares of ALICE households here in the lower corner of our state.
Max, just to answer David's question, Stephanie put in the chat that the median household income in Delaware is about $70,000 in 2019.
Oh, thank you. Thank you.
Wouldn't, I'm sorry to interrupt, but wouldn't that indicate that a greater percentage of households are below the ALICE? If the ALICE threshold was, what was it, 62,000?
70,000.
70,000. No, the 70,000 is the median, right? Or
But David, there were different, whether it's a single person or a family of four, there were different ALICE thresholds.
oh, okay. All right. I'm sorry. I'll shut up.
No, that was a good question. Thank you. And yes, the chat I can't really see very well if I'm presenting. So thanks for looking at that, Molly.
Sure.
So we know that one of the biggest causes of financial insecurity is the quality of someone's job. So this chart maps what jobs pay in Delaware compared to the household survival budget. So it's defining low wage jobs as even with two workers, they cannot afford the household survival budget. And then high wage is classified as that a single job can support a family on the household survival budget. So the chart on the right shows over time from 2007, what is the trend of those jobs? And so the overall number since 2007 of medium wage jobs has been pretty stable compared to low wage jobs, which has increasingly gone up, increased. Whereas high wage jobs has gone down, and this is the number of jobs. And so the percentage also of low wage jobs has gone up. So in 2007, 32% of jobs were low wage. In 2019, that was a little more than half of jobs were low wage jobs. And so from 2007 to 2019, those number of jobs increased by 66%, whereas high wage jobs decreased by 46%. And when we look at the labor participation of Delawareans, of the Delawareans 16 and over, which is about 0.8 million people, 800,000 people, we see this chart here, which breaks down on the left. The blue boxes are working people classified in working in the workforce. And so only 25% of adults 16 and over are full-time in salary, which we know is usually the most stable of job situations. And especially when we came to the COVID lockdowns, those were usually the jobs that had the most security. So the lighter blue are jobs, are people in jobs that either pay hourly wages or are part-time. And then 3% of that population in 2019 were out of the workforce. Unemployed, but considered in the workforce, actively looking for a job. And so these large boxes here to the right in yellow are the percent of adults out of the labor force. So 19% of Delawareans were out of the labor force due to retirement. And an equal percent, 19%, were out of the labor force due to other reasons. And so that could be disability, that could be caregiving reasons, that could be discouraged workers, not who have fallen out of the typical definition of unemployment, and health reasons is another big reason. So that's 38% of adults in Delaware that are out of the labor force. And so we know that ALICE has less access, owns less assets, and we know one asset, home ownership, is a road to financial stability. But ALICE households cannot save for the down payment necessary for those investments. And so when we break down, this is using the American Community Survey, when we break down by race and ethnicity on home ownership, we see that the average of home ownership in Delaware is 70%. White households have a home ownership higher than that at 80%. And then the bars to the right of that show specifically picking out Hispanic and Black have lower, and Asian have lower home ownership rates. And we see the same relationship with income as well. Okay, this is now going to be a transition to a report we worked on throughout the pandemic, and we brought out in October of 2021, called The Pandemic Divide. And so these are what I'm going to present are national data. They're not going to be like the ones before that were about Delaware. So these are going to be the result of our analysis of national COVID surveys from the US Census Bureau, did a pulse survey. The Federal Reserve also did a survey. We conducted some of our surveys with our partners across the country. And also the University of Southern California had a very interesting study during COVID that is also still continuing, the survey and I guess COVID, right? So that's the transition into this next portion. So when looking at these survey questions, we were able to break down respondents based on their income, their household composition, and where they lived. And so in doing that, we can break down the questions of those surveys and see what did ALICE answer and what did households above ALICE answer. So in this question here from the Federal Reserve SHED survey, as it's called, the Survey of Household Economics and Decision Making. Below ALICE threshold households really struggle to manage financially. 42% reported finding it difficult to get by or just getting by in July of 2020. And that is higher than the average, which if you just looked at the average of households, it would just be 23% who are finding it difficult to get by or just getting by, which is still a quarter of households. So a lot of households, but more disproportionately for those lower income ALICE and poverty households. Whereas households above the ALICE threshold, 9% recorded finding it difficult to get by or just getting by.
So Max, why is it that I would have thought the 42% would be far higher? Why is it that those below the ALICE threshold were not struggling even more? Was it because of the extra payments that were being made? Were that helpful that kept enough other folks from struggling so much?
Yeah, that's a great question, and I think your hypothesis is a good one. So this question was done in July, and I believe the stimulus payments were, and the first bill at least was passed by then. So government support systems did initiate. So I think that is a great. Had the question been asked in, say, April, it would probably be different from this, higher.
So we have another question from Charles.
Yeah, so that suggests that you didn't take in determining whether somebody was below or above the ALICE threshold, that you didn't take into account what might have been federal COVID payments. I mean, I'm surprised that 58% of people below the ALICE threshold would say they're doing okay or living comfortably.
Right.
It's just the other side of the question that Lynn asked.
Mm-hmm.
Yeah, just to add to what Lynn's hypothesis, also it's likely due to unemployment insurance. That probably also helps some families through those early months of the pandemic while they were receiving that support as well.
So if they were getting unemployment insurance or COVID stimulus payments, wouldn't that have been taken into account in determining their income and whether or not they were below or above the ALICE threshold?
So the income of this survey was not actually taken in July of 2020. It was taken before that. So no, it doesn't. Okay. It wouldn't. Their income is not broken down based on that.
Yeah, that's correct. The income is based on the year before.
Very good question. Thank you.
Yeah. Thanks.
So the next slide that I'm going to show is the same question, but the same survey question, but breaking that down by race and ethnicity. So the graph on the left of this is showing the answer, households that answered finding it difficult to get by. So we see a big disparity between below the ALICE threshold households and above the ALICE threshold households. And we even within below the ALICE threshold, we see that Black households more often were finding it difficult to get by than even white households still below the ALICE threshold. And the inverse of households saying they were living comfortably, breaking that further down into race and ethnicity, even households that were making enough for the ALICE threshold, above the ALICE threshold households, 56% of those reported living comfortably, much more than Black households above the ALICE threshold, 33%. This was the same question as before. from July of 2020. So one big shock for us all that we remember is the lockdowns, and that had a big effect on what Lynn mentioned, essential workers. And so this really brought a lot of attention to essential workers. And so this question looks at what did workers suffer employment changes? So breaking this down by the ALICE threshold, we see that households above the ALICE threshold were in a much more secure position with their employment, with fewer reporting changes to their employment. Whereas in some cases that was double for households below the ALICE threshold. And breaking that down by race and ethnicity, races such as Hispanic and Black suffered much more changes, including loss of a job or temporary layoff or fewer hours or looking for work than households below the ALICE threshold, white households below the ALICE threshold, or Asian households below the ALICE threshold. But again, if we were just to look at all households, we would see 25% had suffered changes to their employment, which again, a high number, but is masking the racial differences below the ALICE threshold. One thing, in addition to employment changes that could have helped families was ability to have some rainy day or emergency savings. So another question from the Federal Reserve Board that was drawn in November of 2020 was have those households been able to save for an emergency or rainy day fund? And so the average is for 55% of households were able to set aside emergency or rainy day funds for 3 months. But then if we break that down by the ALICE threshold, 32%, a third of ALICE threshold families were able to set aside emergency or rainy day funds, whereas 71% of households above the ALICE threshold were able to save. And then breaking that down by race and ethnicity, we see the same story we just told, which is that white households in both below the ALICE threshold and above the ALICE threshold were able to save compared to households of color, Hispanic households and Black households. And these are some other findings. We were also able to break down families if they had children, and because the child care industry was very affected during COVID lockdowns. And so we wanted to delve into what happened with those families. And so, for example, 56% of those families were concerned about not having enough food, or 42% concerned about a reduction in wages, and 41% concerned about household wages, members losing jobs, versus 20% above, 20% of those ALICE household children above the household threshold, I'm sorry. So these are just some insights that we were able to get with the pandemic. And at the end, we'll show you just some where you can find these reports, so you can delve in. There's many more findings on our website. So I think that this part is for you, Catherine. So
We have one question, Max,
Sure.
from
Sure.
Dave.
Yeah, just one quick question on the surveys that related to the pandemic. Were those nationwide surveys, or were those Delaware? Or are they broken out by Delaware?
Yeah, we were only able to break them down by the country.
Okay, I
Yeah.
assume, but yeah.
Thank you.
Thanks, Max. So I know we just shared a lot of data with you, a lot of different stats, and I just want to take a breather here and see if there's any additional questions before we just share the last piece with you, which is about our new ALICE in Focus series. But we can take a breath here if you have any questions.
Sure. I guess I want to go back to one of Charlie's original questions and make sure I understand the answer that I think Stephanie gave. And that is that if you look at the total 38% that are below the ALICE threshold and say 11% of those were the folks below the federal poverty level, so the 11% are the ones who are receiving the government services, and the funding is going to those below, that are in that 11% below the federal poverty level. And then that other 27% of ALICE, was the answer that they are, for the most part, not receiving government help? Is that?
Yeah, that's
correct?
Oh, go ahead. Do you want to answer, Max? Go ahead.
Oh, sure. Yeah, I was just going to ask. So firstly, not all poverty households are going to be receiving or participating in those programs because of caps to those programs or barriers to receiving. And various programs have different eligibility criteria, usually based on the federal poverty level. So for example, SNAP in Delaware is 130% of the federal poverty level, which means that it would be eligible for some ALICE households based on the income. So we have an analysis in the report which also breaks down those government programs. But yeah, that is some eligibility criteria crossover. And then one other consideration is what's called the benefits cliff, which is kind of a drop off of benefits from these programs. And where does that leave families in this ladder?
Okay, a couple more questions there from
Sure.
Norman, Judy, and then Dave McBride.
I see the data you have is for quite recent. You have historical data that you can look and see where the changes were. For example, the data you showed that things look pretty bleak in Western Sussex County.
Right.
But 30 some years ago or 40 some years ago, there was a nylon plant in Seaford that employed 5,000 people. And I suspect they got pretty good wages. And would they have been that dark color and blue? Would they be something else? And
Yeah, that's a great point.
I have,
Definitely.
and I went to high school 4 blocks from the General Motors assembly plant.
Yeah.
And those people had union wages, and they had the same thing down in Newark. And I just wonder whether let's say that the fact that these corporations have left have had a dire impact upon these communities.
Yeah, I think that's a great point. And I was going to mention, I studied at the University of Delaware, so I was aware of the closing of that plant. And I think that is a really great point about the industry of Delaware, and not just Delaware, but a lot of the Northeast corridor. So our ALICE data we've been collecting since 2007. When you start going earlier than that, the government sources get a little less descript when it comes to the breakdowns that we need. So we do track from 2007, which is before the recession, but not 30 years ago, like you mentioned. Is there another? Who is
I think
next?
David has his hand up.
Yeah,
Oh, and Sandy.
I think can you hear me?
Yes.
I'm still not clear. Are transfer payments included in the computation of the household income for determining who's above and below ALICE, or are they not? Or
Oh,
do you
yes.
know?
They are. Maybe I don't know if Stephanie is able to, I think she's having audio problems. So the income is self-reported. So if a family reports that in their income, then yes, it is.
Okay. All right. So it may or may
So-
not be depending on who's reporting. Okay.
So
thanks.
I'll read one thing Stephanie put in here apropos of the conversation, and that is, we'd love to do an historical study. Data before 2007 is not directly comparable. With some time and resources, we could probably overcome that. It's on the list.
Yeah. And David, did that answer your question?
Yeah, I think so. If I understand correctly, the transfer payments may be or may not be included in the household income, depending on whether the people surveyed reported it or not.
Right. Yeah.
Okay.
Yep.
I think it would be very unlikely that somebody asked about their income is going to report some number associated with food benefits or housing subsidies or anything else, unless the specific question were asked.
Mhm.
Right, in which case it would be interesting to see that overlaid on the
Mhm, mhm.
things. I think Sandy or Roger, there's also another hand up.
Yeah, this was the chart that was most striking. And I have to say that I called on that Seaford plant many times, and that even in 2007, it was beginning to be a bit of a ghost town. But does this, we hear about the Great Resignation, people leaving jobs. I'm not sure, is that compatible with what I see in the dark blue line here going way up? Are these the people that are saying to heck with it and try to do something else?
Well, this is that jump is 2018 to 2019. So the Great Resignation, I think what you're referencing is a more recent phenomenon that is work post COVID lockdowns.
Yeah. Okay. But it wouldn't be on there, but it still looks like. I'm just surprised at this chart. I really am.
Mhm.
Doesn't this chart indicate that the quality of jobs in Delaware has gone down, measuring quality by income and benefits?
Yeah.
Which is something that, consistent with my expectation, that over the last 12 or 20 15 years, that we've lost a lot of good jobs, and the jobs we've grown are tend to be lower wage positions. But
Yeah, and this is pretty consistent of what we've seen in other states across the US. Not every state, but this is a similar pattern that we've seen in many, is that what we're showing here too is what happened after the Great Recession. So many ALICE households did not recover from the Great Recession, but those that were doing better did. So you're seeing high wage jobs did better, medium wage jobs took a little dip and then sort of leveled out, but the low wage jobs just kept increasing, after the Great Recession. So this map really doesn't get to the Great Resignation yet. That came with the pandemic. Our next Delaware report will be in 2023, and that will include 2022 data. So we're really excited for that data, and then we'll be able to see what happened to ALICE households, after the pandemic, even though it might take some time, just like we see in this chart, to see the trend over time.
Was there someone else? A question? Okay,
Those are great questions. Thank you.
yeah, thanks.
So we just also wanted to let you know about this brand new ALICE in Focus series that I mentioned earlier. And so these are topical issues that are focused on specific populations. So the very first one, it's actually coming out on Monday. We're really excited to release this new data dashboard and report on Monday. The first one's going to be on children. Then we're going to have one coming out in July on persons with disabilities. And then in November, we're having a special issue on veterans. And so these are all people with disabilities, and veterans are very often below the ALICE threshold. And we've been asked for a number of years to collect data on children in ALICE households. So that's why we're really thrilled to have this new data. And children, it's just so important, because what children need for healthy child and development is to have access to things like stable housing and food, healthy food and nutrition, access to preventive health care, access to preschool and education and internet, so that they can have access to education, during times like such as the pandemic. So what we see, again, not unlike our other ALICE data, is that children who are in certain race and ethnicities, Black and Hispanic children, are disproportionately in households below the ALICE threshold. So I think we're really looking forward to sharing out this data and helping all of our partners and stakeholders who are doing work in the children's research and advocacy space. So keep an eye out for that. It's coming soon. And these are all the different things that you can dig deeper in on our data dashboard. You can look at children in terms of, as I just mentioned, race and ethnicity, nativity, and language. So we also see a higher percent of children in limited English proficient families that are below the ALICE threshold. Children with disabilities are more likely to be, I don't think these would surprise any of you, more likely to be below the ALICE threshold. In terms of living arrangements, we know that more than 95% of children in the US are living with at least one parent. And if they're living with in a single parent household, they're more likely to be below the ALICE threshold. And then we also look at household work status, and that's a prime driver of whether or not a child is living below the ALICE threshold. So if there's more than one worker in the family, if there's two workers, they're less likely to be below the ALICE threshold. If there's only one, that number increases a little bit higher. And of course, if there's no one working in the household, then the numbers are very high. So these numbers will be released on Monday, but in Delaware, 15% of children are in poverty or below the FPL. Another 33% are ALICE. So for a total of 48% of children in the state below the ALICE threshold. And just to give you an idea how that compares, nationally, there are 49% below the ALICE threshold. So very close to the national statistic. And then these other factors here, we talk a little bit more about in our research brief, also, about things as stable housing, access to education and health insurance, and home internet, and public assistance. And basically what we're talking about in terms of public assistance is access to SNAP in this particular brief. So you're asking all the right questions, and there are children below the FPL that are eligible for SNAP and are not getting it. And there's a host of reasons for what that could be. And, in terms of just not getting access to the service. So we're bringing that to attention. And then there's also children below the ALICE threshold that are eligible, but not accessing SNAP either. So we're trying to draw attention to that as well. And then this is another project. Oh, I'm sorry, questions? Yeah.
Yeah, I was wondering, is any of this information available by census tract?
Right, yeah, that's a great question. I should have said this. So this is a brand new data set for us. This is PUMS data. So it's actually broken down by PUMAs, which is a census designated area of not less than 100,000 households. So it takes the state and breaks it down into these, what we call PUMAs. In some states, they're counties, and others they're like metropolitan areas. But this you'll be able to access all of this on our website very soon on Monday. get a closer look.
But Catherine, I would like to add though, that in the Delaware report,
Oh, in the Delaware report, I'm sorry,
the
yeah.
data available by census tract. So there are
Yes.
two different
Oh,
data
oh.
sets that we're using for
Okay.
two different reasons to get it at specific points of analysis.
Yeah, good clarification. I meant the children brief. Yeah, okay.
Thank you.
Yeah. David, you have another question?
Yeah, I'm sorry, but
No, not at all.
did you may have had this and I missed it because I came a little late. Do you break it down in terms of the who's above and below the ALICE threshold by education level of the parents?
No, we do not. I mean, we talk a little bit about education in our reports in terms of it's not, just as what you would think, people with a lower education level are more likely to be below the ALICE threshold, but we don't have the breakout, the state statistics by education level.
So let me just jump in and say, I know we're at the 8 o'clock mark, but I know we're not quite finished and I know there's still lots more questions. So we will keep
Okay.
going, but I'll try to make a hard stop at 8:15 if we're still
Sure.
going at that
Yeah.
point. And I'll hold my question till you at least finish the presentation.
Yeah, we can wrap up. I'm not even sure how, Max, you want to just see if,
Yeah.
I'll just talk real briefly on child tax credit and I think we can stop the slides. This was another important fact sheet that we did because what we found in this data is that a number of households across the US, actually 5 million, did not receive the child tax credit as of the fall of 2021. And so the recent literature tells us that the child tax credit was really helpful to families that were struggling financially. It helped them afford things like food and pay for their rents. Families with children were using it for childcare. So it was really surprising to us to see the number of eligible families that didn't take advantage of the child tax credit or didn't apply for it. And so we're still trying to get the word out that this money is still available and can be claimed before tax season is over, the mid-April. And so this is sort of just as an example of the kind of work that we're trying to do to make sure that we can, help ALICE households promote their financial stability. So the rest of this, these are just the tools on our website. And I think we can skip through these, Max. I think we've given you enough to chew on for the first introduction to ALICE, but we welcome you to our website. It's www.unitedforalice.org. And if you go to the partner state tab that you see there, you can select Delaware and you can go through the website and take a look at, there's all of the information that we shared with you today is available there, and it's very interactive and you can look locally at your specific communities. And then the ALICE in Focus page that will be up and live on Monday if you want to look at the first brief on children. So I think we can end the presentation slides there, Max, if you want to stop sharing. Yeah. And we can take any additional questions at this point.
I have a general question about the gap between what would be considered the survival budget and what folks are making, and how. I mean, I'm sure it's a very complex answer, but I want to know how much data you have on what fills that gap between what they need and what they're making. Presumably some of it is they're going into debt over time. Some of it, maybe they're getting access to funds through family and friends. They're probably doing without in some of the categories where they're just not able to, get what they need. But how much data do you have in terms of how that gap is filled?
That's a really interesting and engaging question. Thank you. I think in some of the surveys, and so there were usually categories like they got money from friends or family, or they had to sell something, or they had to pawn something, and the debt is very pervasive in ALICE households. And even when we look at questions on stimulus checks or the child tax credit, when we look at what households spent that on, when we look at how ALICE households, they're much more likely to spend that to pay off their debt.
Yeah, and I would just add to that, Linda, I think you really hit all the, I think you really hit it all in what you presented just now. We have a whole report actually on, it's called The Consequences of Insufficient Income. And it talks about how ALICE households are faced with these decisions day in and day out. You know, do I pay my rent or do I take my child to the pediatrician? Do I fill my prescription or do I, go food shopping? It's this constant juggling and trying to figure out, how to make ends meet. So it's an ongoing struggle. And and as Max mentioned, debt it's cumulative. So they're just getting in a bigger and bigger hole, and we hear about that from our ALICE stories. We have connects with people who have done some work with us, videos and things, and they talk about how hard it is day in and day out. Yeah.
So if no one else has a question yet, I'll ask one more. What else do you guys plan to do in terms of trying to get folks who need to better understand this data, getting it in front of them? I mean, I know you did the big rollout, the big Splash United Way, held an event where it was presented, announcements were made, press release, but is there anything else being done to, try to make sure the folks who really need to be looking at this kind of data know it's there and that they are accessing it?
Yeah, I think it's we do it in a lot of different ways. And our reports are certainly one way. We're always through our partners, our United Way partners, and having them disseminate the data and research through their contacts and their stakeholders. Just doing things like presentations like this. I mean, we're always interested in doing presentations because we're just really raising awareness of a population that's still invisible, I think, to a lot of people. And so I don't know if Max or Molly, you want to add to that, but it's.
Yeah, I think,
I was just going to say, which more better than I do, that our partners do a lot of this also across the country about how to message ALICE for their policymakers.
Mm-hmm.
Just what I was going to say, Max. Yeah, it's been picked up in a lot of policy circles across the country because of the policy and advocacy work done at United Ways.
Yeah, and that's one of the tools we're going to show you. We have a new legislative data dashboard that breaks down the data by legislative district. So we're really excited about that because we're going to be able to share the data with legislators and they can see that what their constituents, how many are below the ALICE threshold.
That was federal legislative districts though, right?
It's actually both. Yeah,
Oh,
it's federal and state. Yeah.
Okay, great. Dave?
Yeah, sure.
Yeah, you guys did a great presentation on demonstrating the depth of the problem. Do you have anything on your website that we could access that addresses what causes the problem and what the remedies might be? I looked at this for a program that I did 10 years ago. And when I got to the part of causation, it was like there were so many different causes, it made my head swim. And then when I got to the remedy part, it was like, there didn't seem to be a lot of great ideas on remedies, but
maybe the last slide in our deck, Max. I don't know if you're going to share the PowerPoint, but there is a slide at the very end of our deck that is sort of a summary slide that tries to point out what some of the issues are, how to close the gap, and what some of those strategies are. So that might be helpful to you. We could share that.
And I was going to say it is a multifaceted problem, as you said. So there's a lot, and we have, as I'm trying to bring up this slide, we have something called ALICE, Elevate ALICE, which actually works at increasing quality jobs that Alice is in jobs, Alice is working, but how can employers give a better benefit systems or flexible systems for Alice? So this is, oops. Can everybody see that? There we go. So this is just that infographic that Catherine was talking about. So these things in the middle that are between the households below the ALICE threshold and financially stable households, things like reliable transportation, livable wages, efficient financial tools, housing, quality housing, safe housing, healthy food, access to healthy food. So it's really a lot of policies that can help Alice and have been proven to help Alice. But we kind of at United for Alice leave those policies up to our partners. But we kind of give an idea here of what the research shows helps Alice households.
So I was going to ask the question in a slightly different way, and that was, identify the states or areas where the situation is better, and then examine what's going on there to figure out, what distinguishes those areas. And presumably, it's these points that you just made that are in orange there.
Yeah, well, we're in the process right now too. We're trying to collect sort of a database. We're going to eventually put this on our website of strategies and sort of best practices that our partner states are doing to help promote financial stability for Alice households, and hope to share that out. I guess the only challenge with that too is that states are so different, from one state to another, and the cost of living varies a lot from one region of the country to another. But we still think there's an opportunity there for shared learning and being able to share what's working, what's not working, and why, and have that be part of the helping people to come up with creative solutions. And one of the things that was the sort of the last bullet in the slide there is it's not only to help Alice households, but it's to help, there's an interest for all of us that we don't have, a third of the state or, more than a third of the country struggling. That's not good for that's not good for the economy. It's not good for everyone. So there's a motivation not just to help Alice, which we're all very committed to that, but also that it's, we want to ensure a more stable economy for the country.
So my impression is that since the ALICE cohort is above the poverty line by a substantial part, that you probably haven't done any particular studies about the benefit cliffs issue and how to attack that. Is that right?
Actually, we are in partnership with the Fed. We're looking at that quite closely because there's definitely a knock-on effect as your income rises and your awards diminish. That's a real problem. So yeah, and a number of states are working directly with the Fed and producing some research about the benefits cliff.
So is there anything on your website about that now, or is that something that's a work in progress?
Yeah, that's a bit of a work in progress. Some of our states have, I think Maryland has published a report on benefits cliff. I know there's one other, Molly, I can't think of who it is.
Texas and Tennessee are working with the Fed as well. And just to reiterate, the ALICE metric is, and the Fed is using the ALICE metric as a baseline for calculating that cliff. So, we're very proud of that.
And Charlie, I think we'll be able to have ongoing conversations with this team. So even the things that are a work in progress, I think we'll be able to tap into in future conversations. So my understanding, talking with Stephanie, is that she'd be open to that.
Great. Yeah.
Great work, guys.
Thank you.
Thank you so much.
One
Nice to
final
meet all of
question.
you.
Yeah, one final question to close us out and possibly lead to follow-up presentations within our Peace and Justice Work Group. Can you talk a little bit about the overlap between this and other data sets, whether they be ones like from the National Poor People's Campaign, where they look at not only some of the same income and financial data, but also overlap that with those who vote and don't vote and things like that. Can you talk at all about the overlap between those data sets?
Yeah, that we actually have recently started talking with the Poor People's Campaign. I think it's 40%, they say. So there's a lot of overlap with our data and their data, and so we are talking, and just like with our talks with the Fed, how can we align these data sets, because we're all working towards the same goal, which is more quality jobs, so that ALICE can survive and thrive, which is what we know we need for a strong economy. And so also I was going to say the United Way of California is another example of research that they've actually kind of done a quasi ALICE research, but we include people with disabilities, and actually we include people of all ages. So there are some differences in some methodological differences, but as I said, all working towards the same goal.
All right. Well, once again, thank you so much. We appreciate having so many people from your team here to present and answer our questions. It was really, really well done. Much appreciated.
Oh, thank you for having us.
Thanks for having us.
All right.
That
Thanks.
was great. Thanks a lot. Right.
Night, everyone.
Good night.
Good night.